that toes the line between being overly spiritual about psychotherapy versus like, no, the things that I'm struggling with are interlaced with my spiritual life.
Welcome to Tea with Dymphna. We are two licensed psychotherapists.
Today we're going to be talking about how therapy with a Catholic counselor might be different than somebody who's non-Christian. So
let's jump right in. I think in general, I would say that, so Lauren and I, we're licensed psychotherapists who are also Catholic, but we don't have like a special training in like Catholic therapy, right? I mean, I know I've heard there's some like biblical counseling that's like based on biblical figures, but that's not kind of what we're talking about today. We're really talking about people who have just gone through the kind of the regular psychotherapy schooling, but who are also practicing Catholics. And a lot of the people that I work with who are Catholics they really want a therapist who is Catholic. Would you agree? Is that been your experience?
Yeah. The practice that I'm currently at, while not advertised as exclusively Catholic or Christian, it is advertised as a family practice, which is focused on keeping families together. Obviously, there are exclusions to this, like abuse, etc. But the point is that there's a cultural background and worldview that is in alignment with the people who tend to show up at this practice's doors. And I would say that's one huge advantage.
Yeah, so you might be wondering, if you're Catholic and you have some mental health issues, or just you want to talk things through with a counselor, does it make sense? Like, should you look for a Catholic therapist? That's kind of what we're talking about today. And as I was thinking about this, I want to say it probably depends on what it is you're seeking treatment for. Would you agree, Lauren?
Yes.
Like, for example, a lot of my patients with scrupulosity around religious rituals, it's probably helpful that I have a deep understanding and context for Catholicism, and that I also have an appreciation of confession, right? That I understand why confession, like what its right place is, and how we in the Catholic Church understand forgiveness and mercy. It's interesting though, because, as psychotherapists, we're supposed to, and we do, right? We put our personal, political, religious views and opinions to the side. In the very early psychotherapy view, right? Therapists are supposed to be this like blank canvas where a patient can project anything onto, right? And so the more abstinent, that's kind of the term abstinence, the more abstinent a therapist is, meaning not revealing about their personal preferences, views, opinions, even like family, the more the patient is just able to see the therapist as a like blank canvas, and is not kind of influenced by what the therapist thinks. And especially because, with a therapist-patient relationship, right? Oftentimes what can happen is that patients want to please the therapist. Not always, but there can be that, right? Because the therapist is in like the helping role. Yeah. And sometimes might take on like a maternal or paternal, like sort of role. And so, if you as a therapist, right? So as a therapist, you do have that kind of like, responsibility to like say that I, would be very strong on like, this is what I think is good. Then my patient might want to like mold into that, but that's not right. We as a therapist, we try to help our patients find out like what their goals are in life, what they want, and like to clarify that. So I think it's kind of a tricky thing, isn't it? Because on the one hand, if a patient comes to me and is outrightly saying, I'm Catholic and it's important to me and I want to make that part of treatment, I do bring that in, and I do, usually then by that point they already know that I'm Catholic because they kind of specifically sought me out. Like they maybe heard about me from friends or family. And so then, then they know I'm Catholic. And so I let that, bleed into therapy in terms of like, I might share a Bible passage that comes to me that I think might be beneficial, or, those kind of things. But yeah, I'm just curious to hear your thoughts on that, of like that, like balance between, keeping our own views back, and really giving space for the patient, while at the same time, meeting that need for Catholic counseling.
Yeah. I think it's pretty simple. in my mind. Psychodynamics in some ways kind of blew the lid off of the idea that the therapist isn't present in the room. I will say, like, I have kind of more of like a relational perspective on therapy, and that's good. There are a wide range of like ethical considerations that each therapist considers. One of the things that I do is I'll ask patients. So in recent years, I would say in the last like 10 to 15 years, the world of psychotherapy, specifically, I think social work, that really, really, really considers systems as a part of mental health. Social workers are like, this is sort of our specialty, and that's my background. We tend to conceptualize like basically that the relationship between a person and their family history, their religious history, that's a part of their mental health. And so the idea of bringing in a spiritual aspect or component to psychotherapy, although it was like by Freud, I mean, Freud would have considered this like, I don't know, dumb.
Do you mean bring
primitive.
in like the patients? Oh, sorry, Freud considered religion.
Yeah,
primitive.
He wanted it out of psychotherapy. It was not a consideration.
For the patient or for the therapist?
For the patient.
Okay.
It was not considered. It was very sort of like clinically segmented. Whereas in social work, we now, in the last 10 to 15 years, there's been a huge pushback to include spiritual assessments in biopsychosocial assessments. And that's what I do. I bring in, I ask people what's their familial background with history. Do they believe that they have any spiritual trauma? What's the nature of that spiritual trauma if they do have it? In the same way that I would ask someone if they have sexual trauma or physical experiences. And I ask them, is this something, no matter what their religious background is, and I've worked with a variety, and it helps that I did study religions in college. But the point is that I ask them, how would you like to bring this in if you do want to? And what's your background? And then we begin to explore together maybe why they've ended up where they are. And if people think that this doesn't affect mental health, then they're not considering the whole person. And we know, there's increasing amounts of evidence that there's no way for you to separate your mind, body, soul. There just isn't. You are one being, and you can't separate these things. So that's how I do it, is like, what's your background? What's your history with this thing? Do you want to bring that in, and how do you want to bring it in?
Right. Yeah, that's definitely how I work too, is I work kind of like from a very client-centered approach, meaning that if the client brings it up, like I will definitely make that part of treatment if it's important to them. If it's not, like some of my patients might be religious, but they don't really ever talk about, like they don't bring up that this is important to them. So I don't either. I allow them to set the stage and to bring in what is important to them. But I'm curious, Lauren, how would you say, if you look at therapy with patients that are Catholic and have said that this is important to them, that they want this to be part of treatment, how, like, would you say is maybe some of the therapy that you do with them different compared to a patient where this is not, maybe they're not religious, maybe they're spiritual but not religious, maybe they're not Catholic or they're not Christian. What are some differences that you notice?
I would say that the way that I approach the therapy feels the same to me, because it's just client-centered, but the topics, the wide arrangement of things that we can explore together, and the connectivity between those like traditionally segmented aspects of their life become more cohesive. And I would say my argument, and I say this in almost every therapy session that I conduct, or every assessment that I conduct, one of the things that I'll say is psychotherapy is excellent, and we can do a lot of great work together, including a spiritual element, and you like bringing that into therapy really allows for you to become like more of a cohesive and almost transcendent person in a way, because psychotherapy, just like medicine, can only go so far without one another. And that's the same thing for if you believe in having a spiritual being and being a spiritual being, that's, you have to necessarily include parts of that in your mental health journey. Now, whether you're doing that on the side by yourself or you're including your therapist in it, no judgment. But the point is that it is a really important aspect of a person. And I've worked with many people who at the beginning, when we do the initial intake, they'll say something like, I don't want to include spirituality in my sessions. And I, with absolutely no pressure, will like, okay, and this is, just so you know, like, psychotherapy only goes so far. The rest you may end up wanting to do on your own. Maybe you'll find like a spiritual guru or somebody to help you through that. And then in the end, though, just by the nature of the kinds of questions that people ask themselves, it becomes existential. And there's always a point at which I'll say, now my hands are tied, because we don't want to talk about, what happens after I die? Why should I not be afraid of death?
Yeah.
Why do I feel so alone? Like, there are tons of these like existential questions that psychotherapy itself cannot solve.
Yeah.
And so I would say that's one advantage on the patient's end. Like, as a therapist, I'm going to essentially conduct myself basically the same way, but on the patient's end, a willingness to explore these topics just helps them become a more integrated person themselves.
Right.
So
yeah,
I don't know if that like fully answers your question, but
yeah, I find when I work with patients who are not Christian, obviously, like, I have to work extra hard to really keep that part back, because again, with a client-centered approach, that's really important to me. If my patients are clearly not, they're not Christian, or they don't want to make it part of treatment, it's not my right to bring it up or to, push them in that direction, right? God forbid. I mean, that's just not what we're here for. Like, we're not coaches, not that coaches would do that, but, I think even more so than coaches, our opinions don't actually matter in therapy. Like, sometimes my patients will, especially if we have a very close relationship, they'll ask me, Elizabeth, what do you think? I want your opinion. And whenever I get that question in my mind, I'm like, okay, I have to be very careful now. They're asking my opinion, but I have to really discern in that moment, is my opinion, because, as a human, I have opinions, of course. Yeah. I have opinions, I have thoughts, I have feelings about stuff. As a therapist, those have to go to the side. But when a patient is actually asking me, what do you think? I really want to hear what you think, like what your opinion is on this, not just what do you clinically think, but what do you think? I have to be real careful. Does the opinion that I have in my head, is this going to serve the patient?
I have a question about this.
Yes.
For you. What are some of the ethical and clinical considerations that you make before offering an opinion versus like redirecting that question back to the patient?
That's such a good question. Well, I think part of it is, do I feel like the person is ready to receive what my opinion might be? Like, are they in a place where they would be able to take that and implement it? That's maybe one. Because sometimes you feel like, okay, maybe like someone is like grieving, and just like the place where they are in grieving, they're just not at a point where they can hear like what like the next step would be. In which case, actually, if for some reason I discern in that moment, I don't think my opinion is going to serve the person, the way I would redirect is to say, I'm curious as to why you're interested in my opinion. I would kind of see, and then we might talk about like insecurities they have, like difficulty making a decision, or wanting someone else to make the decision for them, right? And to be like, let's talk about that. Like, let's help you. Let's clarify what you want. Let's clarify what's going to serve you. What is their motivation for asking for my opinion, right? Is their motivation to want me to make the decision for them? I actually find that a lot of times they want that like outside perspective.
Yes.
And I think one other thing that I take into consideration is the patient someone who, if I share my opinion and they don't agree with it, will they be able to be like, okay, that's Elizabeth's opinion, but I don't need to do anything about that. If I feel like they have that confidence, I can share my opinion if they ask for it, because I know they will take that, think about it, and decide what they want to do with it. If I have a patient who's emotionally a lot more vulnerable, or maybe, like has the tendency to like be like dependent on others, where what I say there's going to take as like gold and like this is the absolute truth, then I would be very careful to share my opinion or redirect probably, because I don't want to manipulate them and being like, so yeah, I would only share my opinion if I felt like that person could, had the ability and the confidence to disagree with me, right?
Yeah.
If I feel like my patient at that moment would not be able to disagree with me, I can't share my opinion and like my personal opinion. Because also like I'm not, we're not their friends. I mean, we have, the relationship can sometimes feel like close friendship-ish, but it's definitely not a friendship. And yeah. You want to say something?
I agree. It's essentially, I would say that I have the same considerations, which are essentially motivation, their ability to individuate from people in positions of however they perceive you. Maybe they perceive you as an authority figure. I would say generally when I feel that someone's healthfully individuated enough, they generally see me as a collaborator. So when I sense that they see me as a collaborator, they're interested, and I sense that their motivations are just to have alternative perspective, I'm inclined to share. On the other hand, if I feel that somebody is codependent or very vulnerable, that might be a time when I become more relational, and I ask like, what would be effective or helpful for you about knowing about how I feel about it? Do you think that that's something that would affect you at all if I told you and then you did something different than what I expressed I thought was the right thing here? Or I might take it in like, that's kind of a meta conversation, but I might even take it into less obvious realm of just like, oh, interesting. Like, what makes you ask,
Yeah.
So, and not all of this, I want to be clear, just so people don't perceive that all of these thoughts are super duper conscious to every therapist when they're performing, when they're in session. I'm not thinking about people. It's very hard to talk about psychotherapy without people imagining that you're being super clinical and not relational in the moment. These are not thoughts that like, these are sort of intuitive, reflexive responses from most therapists. I would say we just sort of innately, and then we've been given language to, in the aftermath of doing a session, to then talk about what our response was and why. But these aren't things that I'm doing or I'm like, math calculations in my brain. Like, that's not how this is. It's very reflexive. It's very like spontaneous, and it feels natural and normal for me to be doing.
Yes, that's right. It's that intuition of, this is where I think the relationship is at, and this is where I think the other person's at, combined with the clinical knowledge. But I think it's both. But yeah, you couldn't just, that's why it's almost like hard to give like a one-off answer, because you're also in the moment getting like a feel for like what's happening right now in the situation, in the therapeutic situation.
That kind of brings me to another question that I have for you. And this might even harken back to the original question that you asked me. And it's kind of funny because it feels like we went all the way around the house just to bring you back to the front porch. But relationally, do you think at all that someone bringing in their spirituality changes the therapeutic dynamic for you at all?
Wow. That's a great question. I don't know that I have an answer to that saying that it always changes it in a specific way. The one thing that comes to mind is that, as humans, if somebody is similar to us, right, it's oftentimes easier to relate to them, to feel close to them. So I think if somebody has the same religious background as me, sure, I think that could give us that connection and make me feel like you're someone like me, right? I think we're kind of wired that way, that if someone is like similar to us, it can be easier to relate to them. Yeah. It also means I have to maybe be a little bit less aware and like controlling myself in terms of like, is my religious view coming through or not? Because with someone who's not religious, I really try my ever so hardest to really not let that be any part of, not even like what I say. Obviously, like I wouldn't like bring it up to somebody who doesn't want to talk about it, but even like micro reactions, like what do I pay more attention to? How do I respond with ums or, like, right. Any of those like reactions can like sway what a patient is sharing. And so with someone whose religious background is very different from mine, I have to keep myself much more in check and to make sure, am I truly being, I mean, relationally, but still like that blank canvas in that way where, you know, what I think religiously about their lives doesn't
Factor in.
Right, doesn't factor into treatment. Now with someone who's Catholic, that can be a lot more like fluid. Like they might bring up something about their Catholic faith, and I can, you know, I don't need to like hold back on, you know, me saying I agree with that, you know, because it's right. If at that point I have disclosed that I'm also Catholic, you know, that can be something that we share. So I think there's maybe that more, on my part, being able to be open with my faith, you know, how in to the degree that the patient is willing and wants to, and to the degree that it serves the patient. I think that's really important, is that whatever, you know, whatever I say or do in therapy should always benefit the patient, right? I never bring anything in or say anything to benefit something that like I want in the moment. It's always if it benefits the patient. And so I would say that's probably one. Yeah. How about you, Lauren?
So of course there's a difference in the dynamic between somebody who has this religious background or that religious background. Specifically Catholic in my case, because I was raised Catholic. I'm a practicing Catholic now. It's kind of like, I think the example that I might use is I was one time walking in a marathon with this woman that I had just bumped into and met her that day. And she was talking about, she was from southern India, and she was talking about psychotherapy and how she had found a therapist, and she was making so many gains and grounds in her life. And a really big thing for her was finding another person who was also Southern Indian to talk with about her experiences. Like this was a huge thing for her. And I was really curious. I was like, okay, like tell me about why that was so important to you. And she's like, because I can say something and I don't have to explain any of the historical or cultural context for that. Ooh, that is I would say, if you're Christian or Catholic working with a Christian counselor or psychotherapist is beneficial in a way because it's in the same context of like, we're from the exact same region of this country. Mm-hmm. You don't have to go into explicit detail as to why something's important for you or how it's relevant to your system of beliefs. That's one benefit of working with somebody who has the same religious background as you.
Yeah, that's so true. Yeah, now that you mention it, that is very true. And I think and hope that my patients who are Catholic benefit from that in terms of, you know, like when they talk about confession, they don't need to explain confession to me. They don't need to, you know, I mean, at the same time, you know, I do try to be curious about how are you experiencing your faith, right? I think that's maybe the flip side of the coin, that we be careful to not think, well, you're Catholic, I'm Catholic, so I know exactly how you experience your faith, right? Because that, you know, we don't want to assume that, right? We still want to be curious to see, okay, this is my understanding of confession. What does confession mean to you, right? Maybe confession to me means reconciliation and I feel close to God. Maybe to them, it's my obsessions get worse. I feel anxious around confession, right? Like I dread, you know, so I think still being curious, like, how are you experiencing it? What is your vision? What is your idea of God, who God is, God the Father, right? I can't just assume, we're both Catholic, therefore I know exactly how you see things or perceive things. But I mean, generally, I would totally agree, Laura, is that there's that mutual understanding of the beliefs of the Catholic Church and the sacraments. Yeah. And that can make it easier. I'm curious as to what you would say, Lauren, if somebody were to come to you, somebody who's seeking treatment, and they would say, what do you think, Lauren? Do you think I should seek out a Catholic therapist, or does it maybe not matter if I seek out what do you think you would say?
It would be dependent on a few things. Maybe the same exact considerations that I would have about whether or not I'm sharing my opinion with them. Their ability to individuate from people that they might see in positions of authority. Do you have like the ability to differentiate between, okay, this is this person's opinion and this is my opinion, and although they differ, we can still exist in relationship together? Like, do you have those kind of healthy foundations for relationship and disagreement? Or have you been wounded in a way that it's like, when I, you know, in the past, when I was a kid, when I disagreed with my parents, I was punished in these really severe and like harmful ways that make it very difficult for me to defy the opinion of another person that I value or hold in esteem. So that would be one consideration. The second consideration that I would have is what the diagnosis is and their motivation for therapy. So really the exact same two considerations for sharing my own opinion in therapy, because I've had many patients come to me, and sometimes after the very first intake session, which is crazy, but also sometimes after a few weeks of working together, say things like, my last therapist that me and my husband went to, I brought up in therapy that it really upset me when he was watching pornography. And my therapist, my female therapist, said in session, you just need to get over that. Which is, first of all, let me just begin by saying, that is completely and totally unethical for any therapist to say to you in a session. Not only because it's a violation of your personal beliefs and also incorrect, the number one cause of divorce in the United States right now, and especially during COVID, was pornography. So BS. Second of all, a therapist cannot tell you what your goals are for treatment. If you come in as a couple and you're doing couples therapy and pornography is an impediment to the relationship between you and your partner, that has to be a goal for reconciliation in the treatment. Like that's an obstacle to relationship, and the therapist is treating the relationship between two people. So when you're doing couples therapy. So my point in all that is to say, like, if you're the kind of person that can enter therapy and recognize, like, this therapist has motivations that are different than mine, and you feel like you have the strength of character to say, like, actually that's out of line with my personal goals for treatment, then I would say you can really go and see whoever you want. But if you would be really damaged by a response like that, I would say seeking somebody who aligns with your religious worldview could be really, really helpful for you. But even I would also say personality wise, and I think this is not something that maybe people consider, is that really and truly a therapist that takes their ethical considerations seriously. And this, I hope, it brings some comfort to maybe somebody who's watching that doesn't identify as anything religiously, and would still maybe be interested in seeking therapists with somebody that, or seeking therapy with a person that does have a religious background. I hope this brings you some comfort. The truth is, I see it as such a tremendous violation of another person's dignity and autonomy to ever feel like it's okay to push your personal beliefs down another person's throat, which is what it is. It's so wrong. It's so vile. And so any therapist that you're working with, whether they're Catholic or otherwise, if they're telling you what to believe and they're telling you what you can and can't consider a goal in therapy, they're out of line. And you should know that. Everyone, I feel, should have that in their back pocket. And you can leave. You can find another therapist. There are many other therapists. So regardless of whether or not a person's Catholic or otherwise, it's like, at the end of the day, our goal is to help you identify your goals, whether that's through Socratic questioning or anything, and then to help you achieve them with whatever tools we have in our box. So, that would be kind of what I would say.
Yeah, I think in general too, if whatever you're seeking treatment for requires or would be beneficial for your therapist to have an understanding, like you were saying, Lauren, like an understanding of the cultural background and just the lingo, like the Catholic lingo and what sacraments mean, if that will be beneficial to whatever you're seeking treatment for, then I would recommend finding a therapist who is Catholic. Like, the example, like scrupulosity is, I think, a good one, right? Like, it's helpful to have a therapist who actually understands kind of confession. If you seek treatment with a therapist who's not Catholic, they might deem the confession itself as the issue.
Right.
And not what's the obsession, right? What's the disposition? What's the obsession around confession? So I think in that case, for example, probably wise to find someone who's Catholic, who acknowledges the goodness of confession. And obviously here I am, proclaiming my opinion, right? I would never do this in treatment with a patient who isn't Catholic who isn't Catholic and who doesn't want to, I wouldn't say, oh, you should probably go to confession for that, because like you were saying, that is absolutely not, it doesn't matter what I think about confession or sin, like what my concept is of that. But with someone who's coming in with scrupulosity, I can help them because it is their goal. Like it's not their goal to eradicate confession out of their lives. That's not in line with their values. What's their goal is to be able to go to confession and use that sacrament for what it's meant to be, right? For reconciliation. So in those cases, when you feel like having a therapist who understands the context and the environment and the sacraments of Catholicism, then yes, I would recommend seeking out a Catholic therapist.
And it kind of sounds almost like what you're saying is that when treatment is partially wrapped up in your religious worldview, so like when what someone is struggling with and their religious aspects of their lives are intertwined or blended, that might be a time to seek somebody who's Catholic and really have that be a strong consideration, or Christian. Whereas if you're talking about a very sort of just like cut and dry clinical, maybe like ADHD, maybe you're struggling with like motivation and discipline. If there's somebody who specializes in ADHD, like motivation and discipline, and who knows what their background is, but they're a good therapist and that they've been effective, this might be an example of a time when it's like, take the specialist.
Take the specialist. Yeah.
And I know that they're, so, and that I think can help someone maybe, that toes the line between being overly spiritual about psychotherapy versus the things that I'm struggling with are interlaced with my spiritual life.
And I will totally say the patients that I have who are Catholic, not all sessions contain conversations about Jesus, right? Like there are sessions, lots of them, where, we don't necessarily talk about religion. It's there when we need it. But like you were saying, we're not talking about like an over-spiritualization of therapy. Right. It's still, our background, like our schools, I mean, I didn't go to a Catholic college, did you? No. Yeah. So we just have a very, regular, secular, I guess, like, therapy education. But we're Catholics. So, we can bring that in as it benefits the patient. But we don't need to, right? Yeah. If it doesn't benefit the patient, we don't bring it in. Yeah. And that's, I think, really important to remember. Yeah. Well, thanks so much for joining us today. I hope you enjoyed our conversation. I know I enjoyed our conversation. This is so inspiring to chat with you, Lauren. And if you haven't already, like and subscribe and leave us in the comments down below if there's any other topics you would like us to talk about. And until next time, have a great day. Thanks for joining. Bye.
Did you know geese mate for life?
I thought that was swans.
Geese do as well.
Are you sure?
Geese? Yeah, for sure. They
do.
Yeah.
Okay. I did not know that.
They're very cool animals.
Oh, really?
I think they are.